welcome everyone to today's Women's Health Tech Wednesday. I am your host for today. My name is Ansley Bowen. I'm the Community Development Manager here at HitLab. And before we bring on our guests for the day, I just wanted to let everybody know that we have our July symposium coming up at the end of July. We're going to be talking about patient-centered tech using digital health for disease prevention. So I encourage you to check out the link in the chat and register to attend this complimentary event. And now I would love to introduce our guest for today, Dr. Helder, who is the CEO and founder of Octin Health. Thank you so much for being with us here today, Dr. Helder, and I would love to hand it over to you to do an introduction on yourself to our audience.
Like you said, my name is Meghana Helder. I'm a cardiac surgeon in Minneapolis. I've been in practice for about 6 years and I'm currently practicing clinically. Did all my training at Mayo Clinic prior to that, and have just recently, about a year ago, started a medical device company to help develop a surgery enabling tool in cardiac surgery.
Amazing. And I would love to know what inspired you to found Octin Health and what unmet need in healthcare that you're trying to solve.
Sure, absolutely. So, I've always had kind of a passion for aortic disease, and that was mainly because aortic disease is the highest risk operation we do in cardiac surgery. It can vary very widely based on the volume that a hospital has. So, it's also one of the biggest health inequities in cardiac surgery, as far as outcomes. And lastly, it's kind of the source of our remaining emergency that can have operative mortalities of about 25%. And so for me, I had a few patients in a row, about 4 patients in a row within a 2-week period of time that had this emergency. And I knew they weren't going to do well based on kind of the operative technique that we had to put them through in order to do this operation called deep hypothermic circulatory arrest. And so I wanted to see how we could do better by them by reducing the physiologic insult that they get when we do this operation.
Wow. Yeah, I was going to ask, how has your experience as a cardiovascular surgeon really helped influence that core vision behind Octin?
Yeah, I think really it's not until you understand the techniques that we use and
Mhm.
how patients do afterwards that you start thinking about how can we do it better. It's obviously very difficult for a non-cardiac surgeon to think about an operative technique the way that surgeons do. And so
Right.
it's having that background to then start to think about. I'm reading a book called So Good They Can't Ignore You. And one of the things he talks about is innovation really happens in that adjacent possible realm most of the time, right? The moonshots are one in a million, but most innovation happens in that adjacent possible. And you have to truly understand the realm that you're practicing in to be able to get there. And so it is that expertise that comes with being a surgeon and the experience of treating these patients that leads to thinking about how can we do better.
Wow. And I just want to say, considering how busy your schedule is with saving lives and everything else that you do with running Octin Health, I don't know how you have any spare time to read, but I love that you are able to do that and it just seems so well-rounded. Again, I can't imagine how busy your schedule is. And kind of talking about the foundation of Octin Health, I'm curious, what does the name Octin Health represent? And then how also does that completely tie into your mission and values?
Absolutely. So it's a little different. So the name itself is, I'm a fairly superstitious person, and I think you'll find that most surgeons are, whether we admit it or not. And so 8 has been my favorite number for, most of my life. And so that seemed like a good way to represent it. And it's always meant hope for me. And that's the name we chose for this. And from a mission standpoint, we always talk about kind of surgeon driven, outcome oriented, because at the end of the day, the reason that I started this is to help surgeons serve their patients better. And in an age where I think a lot of innovation is focused on what can we do minimally invasively, cardiac surgery enabling tools haven't been thought about in the same way that they used to be, 20 years ago. And I think there's been this thought by the large medical device industry that cardiac surgery is slowly fading away. But what we've found right over time is cardiac surgery isn't being replaced. We're just getting a different population of patients, more times now complex,
Mhm.
and have failed those, minimally invasive and other endovascular interventional techniques. And so now is really the time when cardiac surgeons need those enabling tools so that we can perform better for our patients that are showing up at a much more worse state than they used to 20 years ago.
Wow, absolutely. And I mean, I have so many other questions that are running through my head because I feel like it's very rare I get to talk to one-on-one to a cardiologist. And I'm thinking like, what kind of foods am I eating that's, probably worse and what's happened in the past 20 years, as the shift from, how we maybe used to eat or exercise to what we do now and how much does that affect cardiology care. So I have tons of questions that I could ask you. It's truly so fascinating. But as being, a startup and founding, Octin Health, I know there has to be also some challenges that you faced as well. So were there any early stages of building Octin Health that you did face some big challenges?
Absolutely. I mean, I still think every day is a challenge for, we're 1 year old, and maybe I'll talk a
Mhm.
little bit about how we started. Those
Yeah.
patients I was telling you about really were around Thanksgiving weekend on 2023. And I was just so tired and so on the edge of feeling a loss of control that the
Mhm.
only thing I had to offer people just wasn't good enough. And I remember, I drove home at 1:30 in the morning, and instead of taking a nap, I kind of just super glued some things together and drilled some holes in my basement, just out of pure frustration.
Wow.
And that was, like I said, November. And I wrote up some provisional IP, submitted that in January. And then under an NDA, I went to a large medical device company and I said, I think I have a really simple, but incredibly needed fix
Mhm.
to allow surgeons to decrease the physiologic insult for their patients with aortic operations. And they kind of smiled at me and said, "That's not how it works anymore, Dr. Helder, right? It's you kind of make it, and then we maybe acquire it.
Mhm.
It is when you show that it can work." And that was a little bit of an eye-opening experience for me, because in my training, I actually spent a lot of time in the translational lab, working on a new type of aortic valve. And
Mhm.
it was, incredibly collaborative. Yeah, this, thinking of an idea and then being able to apply it. And to go, so I didn't have that anymore. I didn't have an institution with a lab support. And so here I am, just an individual trying to do something without a lot of resources. And so after hearing that kind of at the end of January, I had to really think about, what am I going to do? Am I just going to let this go? Am I going to try to find an institution that's going to help support? And I looked into that a little bit, and it was uh, very difficult, even kind of being an alumni and being in the Minnesota space, to find that avenue. And so in May, after really long discussions with my family and other mentors and supporters, decided to start a company and self-fund kind of this initial working prototype. And thankfully, being in Minneapolis, Medical Alley,
Mhm.
it was incredibly easy actually to find solopreneurs, with engineering backgrounds that were able to kind of help me build this initial
Yeah.
prototype. And so really spent from May till October developing this working prototype, and then really being able to, I think at that point I talked to about 35 different cardiac surgeons, so spanning from kind of small community hospitals to large volume
Mhm.
academic aortic super centers, and saying, hey, does this idea hold any weight with you? Do you think that would help patients? And I actually got to understand a lot more experiences from in cardiac surgery besides my own, and got some positive feedback. Also talked to some ex-Medtronic executives, again, being in Minneapolis, just from a business idea, does this make any sense? And it was really at that point I decided it had to be bigger than me. Otherwise, it wasn't going to happen. So brought on our COO, our full-time COO, Laura, who has just been absolutely amazing in kind of doing everything. And then also brought on our Chief Strategic Officer, Jason, who has an incredible experience and lifetime in medtech, 35 years, starting in sales, going in leadership, and then with startups. And at that point started raising our seed round. So before I started asking anybody for money, I really wanted a team that could push this forward. I also wanted to have done enough market research to understand that this had a chance of making it. So we started raising our seed round in December, and we've raised $1 million since December, really from physicians, mostly physicians and friends of ours. And we just recently hired our chief technical officer as well, and have committed to a design development partner, and are really moving along the pathway. Like I said, it's really been a month, month and or a year and 2 months. So
Yeah.
seems like we've been kind of chugging along at a good pace and getting some good, um, uh, getting good feedback, as well as reaching some milestones here.
Yeah, absolutely. Well, congratulations, first off, for just having the tenacity to see something that's an issue and needing to solve it and just going after it, and all the milestones and accomplishments along the way. I'm so excited to talk to you again in another year and see where you are now. And it's we're actually going to have Laura on the program later this year as
Awesome.
well, and talk to her. So I'm excited to have a
Yeah,
conversation with her, kind of from her point of view as well. But again, just congratulations and all the hard work. And, sometimes I feel like our greatest accomplishments sometimes happen when we're at our lowest points and we don't realize it. So I'm really just congratulations to you for seeing the need and then going after it. Um, I also wanted to know if you could kind of walk us through like what Octin's key like platform or product, or, how do you market it? What's its impact on the patients and providers?
absolutely. So our flagship product is called the Elica device, and maybe as a shout out, that is a very personal name to me. I have two young daughters who are 6 and 4, and their names are Elia and Annika.
Oh,
Just as you kind of spoke about, everybody kind of talks about work-life balance and keeping them at their bay. And I look at it a different way, that I want all of my life to be interconnected. And so my kids completely understand that when I'm not with them, I'm doing something that's important and helpful. And they appreciate it and want to be part of it. So anyway, the Elica device is it changes kind of how we manage blood flow during aortic arch operations. So the aorta has many parts to it. The most difficult to handle, whether it's from an endovascular open perspective, is the arch, where it gives blood flow to the brain and the upper body. And it's very difficult to control blood flow there, even on cardiopulmonary bypass. And that's because, as you can imagine, if you have a tube that's filled with blood, in order to cut into that tube, you have to kind of clamp on either side so blood doesn't get into that space. And it's pretty easy to clamp on, the heart side of that, because we can easily access it, but it's near impossible to clamp on the other side of that, or the distal side, the descending aorta. And that's because you cannot see or feel the descending aorta from the sternotomy, so which is our normal surgical incision. And
mhm.
so we can't clamp it. And so when cardiopulmonary bypass was invented in 1952, we came up with this way of just taking all of the blood flow out of the body for the period of time it was required to cut open the aorta and sew
Mhm.
on a graft. And to make that safe, we use the bypass machine to cool the body, usually to 18 degrees Celsius, and then we're shut off all the blood flow. So essentially exsanguinate the patient into the bypass machine, and then do this operation, and then put them back on the bypass machine and rewarm them. And it's a really long operation because of the cooling and rewarming. There's a period of time, depending on what operation you're doing, where there's no blood flow to the lower body and sometimes the brain. Now, certain centers, about 30% of the country, get some blood flow to the brain and doesn't cool as much, but it's still a pretty big insult, overall.
Right.
And so what the Elica device does is it pairs with the cardiopulmonary bypass machine, and it actually shunts blood past the aortic arch into the lower body and also the brain and the upper body. So you don't have to cool because you're getting blood flow the whole time. But we
Mhm.
use this, basically endovascular balloons to stop the blood from coming back into our surgical field, which was the whole reason to exsanguinate the patient in the first place.
Right.
So, and by this simple idea that blood flow is good and long times in cardiopulmonary bypass are bad, which
Mhm.
have been proven time and time again in the cardiac surgical literature, we really hope to change the game on how we do these operations. And make them look like every other cardiac surgical operation.
Mhm.
And there's a whole, kind of stepping stone of benefits to the patient population. We hope that the patient that's getting this operation, in a year from now, or in 2028, when we hope to be in humans, sees that the mortality and the complication rate decrease for them, right?
Yeah.
But as we see that it's become patients do better with this operation with our enabling device, then we start to operate on patients more electively and
Mhm.
actually at the guidelines for aortic aneurysms at 5 centimeters, instead of kind of waiting to observe because they're too high risk to do this incredibly insulting procedure. And as we start to operate on more elective patients, we have less emergencies and patients overall do better. And then finally, I think the overall step on how this can help is right now there are zero screening programs for one of the deadliest diseases that we know of. So,
Wow.
yeah, and the main reason for that is because the treatment itself is high risk. So when you think about how the US, task force on
Mhm.
prevention operates, it's about this risk benefit. So why screen for something when the treatment is also incredibly risky? And
Right.
so we've actually find these patients now through incidental findings on a CT scan done for TAVR or calcium scoring or lung cancer screening or for trauma or something like that. But really, we should be instituting the screening program. And even further, speaking to women's health, our guidelines now are completely, to a degree, based on male physiology and anatomy.
Yeah.
So we haven't even started thinking about individualizing patient anatomy. So, for example, a shorter patient should have a smaller aorta, and we should
Mhm.
be operating at a lower diameter. But we don't do that. There's this kind of standard 5 centimeters. And if you
Wow.
look at kind of the journal circulation and a lot of American Heart Association literature, women present in more emergent cases. They have higher mortality and
Mhm.
higher amount of complications, and it's because we're not individualizing treatment. And I think in order to even start thinking about that, we need to de-risk this initial operation.
Wow.
So that's kind of the big goal. But I think it all starts with a common sense change.
Absolutely. What you said made a ton of sense, and it plays into what, we really do talk about here on Women's Health Tech Wednesdays is how you may think of women's health, right? And reproductive health or menopause or something like that, but you don't realize, women also have heart problems.
Yeah.
People like it doesn't matter what gender you are, you have many different problems that are not just related to your reproductive organs. And so I didn't even think about like surgery standards, how it may not be, properly fit to a woman's aorta, like you said, and how, in order to even get there, we have to de-risk the surgery and screen people more and make it, either just more potentially accessible or just less risk overall to people before you can even get there. And so it just every day my mind and eyes get open to more things that we need in healthcare that I had never would have never thought about if I didn't have these conversations before. So just, wow, I hope that one day we can get there and hopefully
Yeah.
quicker, the quicker the better, right? Well, I'm also curious as you are so busy, like I said, and you have daughters and you're starting this company as well as being a surgeon, an active surgeon. How do you balance all these demands on your surgical career with the fast-paced responsibilities of the company and also your personal life?
Yeah. For me, it has just been surrounding myself with people that have similar goals and
Mhm.
purpose, and are supporters, right? Not just mentors, but actually people that are sponsor. And I think there's a huge difference between mentorship and sponsorship.
Mhm.
And I think just speaking, women in general seem to kind of look for mentorship and don't advocate for sponsorship. And I think that was really a tremendous change in the way that I started thinking about things as I had more on my plate. So, I'm an only child, so pretty lucky. And so I have parents that live half a mile down the road that
Mhm.
are an incredible part of my children's lives. And it truly is like an extended family situation where it takes a village.
Mhm.
And my daughters and I, like at bedtime, talk about each of our days, right? We talk about kind of what our day looked like, including theirs.
Mhm.
So just trying to foster this idea that my life isn't entirely about raising them, and that's okay. That doesn't mean that I love them any less, that
Right.
I care for them any less, but they understand um, having a multifaceted life it is good. It's good for them. It's good for me. My partner, who we've been together for 22 years, is one of the most just understanding, supportive, constant cheerleaders that I could ever ask for. And thankfully he has a bit more of a flexible schedule than I do, and it it's and he's shown up in that way. But I guess to my credit, I've never looked at any one of these things as me individually achieving it. And, it's a family sacrifice for things. It's a family sacrifice of time. It's a family sacrifice of emotional bandwidth. And so these decisions were not just me making them, they were made together as a unit. And the same thing for my partners at work. So they are fully aware of this, of this company. They ask about it. I ask their opinion, obviously, as potential end users in the future. And it is, for me, it's been complete transparency and trying to interweave as much of my life as possible, and not creating these arbitrary walls. And, to your comment about like, where do you find the time to read books or whatnot? And, that is usually the first thing that goes, right, is our own health, whether it be mental health or physical health. And it was the first thing I did, like it was really not until 3 years ago or so that I've started working out regularly. I get to ride my bike to work, and so I listen to an audiobook on my way. So it's really carving out those precious minutes where you get to fill up what is, what you need.
Right.
Um, so to so to be able to kind of do that, I think is quite important.
Absolutely. Well, like, again, like just kudos to you. Congratulations to you for all the accomplishments and just being able to carve out those precious minutes that I'm sure you don't get enough of. But kind of knowing that what you're doing has a bigger purpose than
Yeah.
yourself. And I'm sure that's, I mean, just again, the motivation that you have and the tenacity that you have to keep going every day. Again, just huge congratulations to you. And we are really close to time, and it's been an amazing conversation. Like I said, I have so many more questions that I could ask you, but I want to wrap up with two questions. And the first would be, what advice would you give to other clinicians who are interested in moving into entrepreneurship or more of innovation leadership?
Yeah, I think the first thing that I would say is if there's an idea that you want to test out, you want to try to fail as quickly as possible.
Hmm.
And that means putting your idea in first provisional patent, right? Try to protect yourself and then talk to as many people as you can. And the hardest thing to do is uh, hardest thing to do is to allow people to talk about your baby, like your innovation, right? So the easiest thing I think for founders or inventors to do is just talk the entire conversation and not allow for feedback or try to like stave off any questions or concerns that are coming. And so I think that is kind of the most important thing.
Amazing. And then lastly, I just want to ask, what is next for you? And then what is next for Octin Health?
Yeah, absolutely. So for me, really kind of seeing this in human beings. And so currently I'm the CEO of the company, and I plan on being that until we're getting closer to kind of design freeze and we're pivoting to that commercialization, marketing type of activity being more focused. And at that point, really trying to find a CEO that aligns with the company's mission and works well with our culture. But until then, these two things are going to be my main foci.
Mhm.
And after that, I think I've truly loved being in this space where clinical judgment and experience um, really talks to um, uh, like talks to what innovation needs to happen. So in some way, right, after we successfully see this device and this company grow into human beings, there's kind of other iterations in the pipeline. Beyond that is staying active in this medical device ecosystem.
Mhm. Absolutely. Well, again, congratulations to you and all of your accomplishment that you have done. And I can't wait to talk to you again in the future and learn about what you have accomplished for the rest of the year and beyond. It was a pleasure to talk to you today, Dr. Helder. Thank you so much for your time today.
Well, thank you so much for having me, and I appreciated the conversation.
Absolutely. I just wanted to encourage everybody to join us next week for our next conversation. Wanted to thank our sponsors and partners because without them, these kind of conversations would not happen. And of course, we have to give one last huge shout out to our guest, Dr. Helder, who is the CEO and founder of Octin Health. Her LinkedIn will be in the chat, so please do reach out to her, connect with her if you have any further questions. Thank you, everybody, and I hope you have a great rest of your Wednesday.